A very warm welcome and good evening to everyone who is joining us on Facebook Live. My name is Afika Alia and I am a member of MINDA by University of Malaya Medical Society, and I'll be hosting tonight's session. Today, I'll be speaking to Dr. Zuraida binti Ahmad Sabki from the Department of Psychological Medicine, Faculty of Medicine, University of Malaya, in regards to the mental health of students before and during this pandemic. You are most welcome to like, react, and share this live video with your friends and family and get everyone to hop on board and get an insight regarding mental health. To all viewers, you are most welcome to drop your questions that will be read at the end of this talk during the Q&A session by simply dropping them on the comment section on this Facebook Live. And if you wish to ask your questions anonymously, feel free to drop your questions via Mentimeter, so you can simply click on the Mentimeter link provided below. We'll be playing a 5-minute video and our session will begin shortly, so sit back, relax, and enjoy. Welcome to Tea Session #MindYourMentalHealth. You are most welcome to engage and drop your questions throughout this session by dropping them in the comment section on this FB Live or by going over to the Mentimeter link provided below. Assalamualaikum and a good evening to everyone who is tuning in on our Facebook Live. Welcome to our tea session for tonight. My name is Afika Alia and I am a member of Minda by MEDSOC and I'll be hosting today's session. In case you didn't know, Minda is actually a new program started by the medical students of under MEDSOC. Minda stands for Mental Health Illness and Disorder Awareness. We aim to advocate mental health, especially among medical students. Ladies and gentlemen, did you know that 1 in 3 Malaysians have mental health issues? According to the National Health and Morbidity Survey done by the Ministry of Health in 2015, it revealed that the prevalence of mental health problems among those 16 years and above is 29.2%. Lately, topics regarding mental health have become more recognizable. However, the feedback that we commonly get are unfortunately mostly negative ones. There will always be stigma, prejudice, and discrimination towards those who are struggling with their mental health. This should not be the case because most mental health issues are treatable and manageable, and showing them love and support is one of the best ways to help them to go through their illness. We hope that this session will change our mindset that it's definitely okay to seek help regarding your mental health, and we hope that we could try to reduce the stigma regarding mental health that has been circulating among society. Hence tonight, I'll be speaking to Dr. Zuraida binti Ahmad Sabki, a psychiatrist from the Department of Psychological Medicine, Faculty of Medicine, University of Malaya, and is also the program coordinator for the Student Wellness Program, in hopes that she could enlighten us on the journey of eliminating the stigma and also debunk some myths regarding mental health issues. Assalamualaikum. Hi, Doctor.
Hi, Waalaikumsalam. Yes,
How are you
Afika.
feeling today, Doctor?
Alhamdulillah, I feel great and honored to be invited to join the platform, and I congratulate all the everyone who's involved with this. And I think I consider myself lucky to be able to share whatever information, experience that I have throughout my journey as a psychiatrist. And I hope it's a positive response from everyone who's joining us. Okay.
Yeah, we are very glad to have you here with us today, as this is the first session organized by Minda. Okay, so Doctor, to start the engine for tonight's discussion, I think it's best to know your opinion whether this generation is facing more mental health issues than the previous generation, or is this generation just simply more self-aware, more open about mental health?
Okay, to begin with, we are aware about these different generations or generation gap. Now we have been labeling every generation as Gen Y, Gen Z, the millennials. So it's basically the society. The society actually decide every generations by labeling them with all sorts of so-called names given, and it's basically labeling. It can be positive, can be negative at the same time, because not everyone would agree to this so-called labeling. So if we were to discuss about whether on different generations, the impact on the psychological, social aspect of any human being, I would say definitely research has shown that in fact otherwise definitely like the Ministry of Health, they conduct studies at least every 10 years to see the changes in the thinking, the so-called the impact on the psychological response to the environment. For example, like now we are still undergoing the pandemic, so definitely this generation will create another maybe they may call our generations as a post-COVID generation. So every probably every 10 years, every 20 years, definitely there'll be a lot of changes, especially when we are dealing a lot with the social media, and we're getting a lot of information through Googles and all that. So people may not realize until it's too late that things already change. When people start to realize that for example, mental health, people are talking about it. Even the non-psychiatrists, non-mental health experts are already talking about it. So that shows the evidence of the difference in different generations. It gives impact to this so-called psychological and social, impact altogether. So definitely, there's a research ongoing to show that yes, that the different generations definitely create a new what we call as the new generations, like generation Gen Z and all that. So we need to be aware about it because it is also very important in dealing with the ongoing mental health issues. Yeah. Hmm. Do I answer the question?
Yes, you did, doctor. And it's true
Yeah.
because like now we can see in social medias like Instagram, Facebook, Twitter, people are always talking about mental health lah. So that's the difference between the previous generation and this generation, I suppose.
Hmm.
Okay, so doctor, how has the stigma against mental health changed in the last few years? Has it been improving or is it still an issue worth discussing deeper about?
Okay. Stigma is a term again. In order to understand what's going on around us, we need to understand which society that we belong to, especially in our country. We are in a multicultural, multi-ethnic, multi-religion, and definitely in terms of the society where we live in, we there are times that we are not given enough space to define ourselves. So as a result of that, the society will determine what is the standard in terms of for you to be able to function as a person. And this stigma is created by the society.
Mm-hmm.
So, which means if you live in a society where everybody care for each other, so the stigma may not be an issue. But in terms of mental health, even I just realized that this MINDA stands for mental illness, mental health illness and disorder.
Disorder awareness,
All
yeah.
right, and I do see that a lot of stigmatizing points there. So even if you are talking about to the community, recently this counselors, Doctor, I can't remember his name. So he was talking about we need to relabel or redefine mental health. In Bahasa Malaysia, we call it kesihatan mental.
Mm-hmm.
So he said he believed that now, if people are talking more about mental health, people become confused in terms of, are we talking about kesihatan mental or are we talking about penyakit mental? Because
Mm-hmm.
in medical in social science, there's a difference between illness, disease, and disorder. But if we were to talk about penyakit mental, so we can either be talking about a disease, an illness, or disorder. So stigma actually how we perceive the person whom we been told that person is having a mental illness, and that is what we call a societal stigma.
Mm-hmm.
But if we uh, suddenly we realize that based on the video clips that you just and it was a very good, actually very good video. Sometimes by listening or reading, people start to reevaluate themselves, and this is very common, especially we are seeing more and more people coming to psychiatric clinic and talking about, I need to see the psychiatrist, and the reason because I just did this online test called DAS-21, and I think I'm having depression. So I'm very afraid right now, you know. So with this online accessible, what do you call that, assessment of your mental health status, people start coming in to be reassessed. So and these kind of people, they do not self-stigmatize themselves because they do see the need of them to seek help. So stigma is something that prevents people from going to seek help. So it has got to do with help-seeking behavior. So that is why stigma can only be overcome through literacy. So the Ministry of Health has been doing this mental health literacy. Like what you are doing right now is one of the platform in order to impart knowledge on the need to understand what anxiety is all about, what depression is all about, and by understanding that in between mental disorders and help seeking is this stigma. Yeah. So people talk about stigma without even understanding what is it. So stigma can come from that person itself, denying that they have got mental illness, and they start to self-medicate themselves by taking benzodiazepines because they can't sleep, because they're so anxious. Some go to smoking and taking drugs. So these people would not go and seek help because of the worry that if I go and seek help from a psychiatrist, psychologist, or counselors, I'm not a good person. Yeah. So all the parents, the family refuse to allow the children, because research has been ongoing looking at the stigma. They are looking at whether um, in a different generations, the younger ones, for example, the adolescents, and the other generation is their parents or their distant family members. So they found that among the adolescents, they use this social media platform because they do have the need to connect themselves to the others. But unfortunately, what is happening right now is the platform has been used, sometimes has been abused in a way that people start to see being depressed as a trend instead of looking depression as something that you actually need help, you know. So
Yeah.
there are different, because I do have quite a number of youngsters between 20s to 25 who are mature enough to come and seek help, and they share with me about these issues whereby there are a lot of these groups, chat whatsoever. Sorry, I'm very illiterate about this social media thing, but they do have these groups like, you know, it's cool to be depressed, it's okay to be suicidal, you know, and this challenge where if you do this, if you survive, you know. So instead of overcoming stigma by getting proper information, and spreading more and more knowledge on depression, for example, they create another group where they find that let us be in a group where everybody is depressed, you know, and don't seek help, because the thing is, if you go and out and talk to our parents, the parents will brush it off, you know. So so this is where I think a lot of times the issue with stigma has been ongoing and can only be overcome by doing this kind of platform where we get people to become more and more understanding about the symptoms and what to do and where to get help. Yeah. So yes, stigma is still it will be around for the next 10-20 years, because you know you are dealing with the society, and it is the society or the community the ones that need to be informed And fortunately, like I said, research has shown that actually among the adolescents, they try to seek help, but there's always among the adolescents who try to look for help, but unfortunately, those who are supposed to guide them gave a wrong information about mental health. Yeah.
Mm-hmm.
So yeah, that is true. It's still very strong even until today. Yeah.
And then like I feel like mostly the community now they like to self-diagnose themselves with depression
Mm.
instead of
Mm-hmm.
seeking the proper advice, proper help from counselors or psychiatrists. Yeah.
Okay, that's the thing. Unfortunately, okay, we have two groups of, or more than two groups of people who find by doing this self-assessment via online thing, and then they come to see doctors, and they start to feel that they need to see one doctor to another doctor because
Mm-hmm.
they have their already the wrong impression about themselves, especially those with underlying anxiety problem. They become more and more anxious and trigger a string of anxiety symptoms until they start, they use a lot of this medical jargon like panic disorder. I'm having
Mm.
these obsessive thoughts
Mm-hmm.
without understanding what those terms mean. So I have few of those young, university students who started talking about, doctor, I think I'm having dissociative identity disorder. Then I say, oh, what do you mean? When I dissociated myself, and they start taking video of themselves, and then I realized that yes, they have a positive, what we call as illness behavior. They
Mm-hmm.
come to look for help because they think they have some issues, but the problem is they come in with already a preconceived idea which they got
Mm-hmm.
from the YouTubes and all that.
Mm-hmm.
So that's why I said there are a lot of different types of those coming to seek help, and there are people who avoid this help seeking behavior until the symptoms become severe enough. For example, like they have this persistent thoughts of self-harming. So that definitely all of these can only be overcome by doing a lot more of this literacy work, which
Mm-hmm.
you people are doing, which is very, very good. Mm. Yeah.
So, Doctor, as you said, seeking the stigma is actually influenced by the environment, the community. So,
Mm-mm.
with this pandemic going on for a year more, COVID-19, everything has been online. Adults are working from home. Students have online classes and all. So, it's a bit taxing on everyone, uh,
Mm.
emotionally and mentally. So, how
Yeah.
has pandemic been affecting the mental health of Malaysians and especially the medical students?
Okay, we do see during the first and second wave, um, the pandemic, we declared pandemic in our country sometime in February last year. And since then, of course, the panic and all that, without us knowing what's going on, the hospital, and we have task force. And subsequently, we start seeing more and more people with obsessive compulsive disorders coming to be admitted. We rarely have OCDs cases, obsessive compulsive disorders cases admitted because of the the standard operating procedure, the SOP of COVID. So with their underlying anxiety and obsessive OCDs, it becomes worse and affect their daily routine,
Mm-hmm.
and to a point it becomes a burden to the family, and eventually they become depressed. We do see a lot of this group, initially those in the working group, where they either been laid off or they started having all of these symptoms. And then we started seeing more and more university students coming to our clinic. And
Mm-hmm.
then we realized that a lot of these youngsters, they have lost the freedom. you know, the geographical distancing lah, social distancing lah, and again we do see a group of students who are more happy to be away from home. So obviously there are things at home that make them feel even more distressed. But there's a group of students who, the moment the government is going to declare MCO, and they already pack their things and go back home, or the parents starts coming and fetch them. So the thing is, how this pandemic affected the medical. Okay, we talk about the group of not just medical students. I think students overall is number one is how this new methods of teaching and learning has affected the students.
Yes,
They
true.
are forced, they are forced to learn online teaching. Some back in the kampung in Sabah and Sarawak, you know, the story where this girl has to climb a tree, go to the highest mountains and all that. So so it created a lot of distress. And then as a result of that, of course, the student will be very concerned about how are they going to perform academically, especially those in the final years, for example. And then the issue about those in the B40 group, where they were not allowed to go back home, and they're forced to stay in the hostel, and you know, not having enough money. So all of this psychological, social, academic, definitely as medical student, I would say that the impact is even more profound, because we as a medical, I mean you as a medical student, you not only have to rely on the virtual teaching, you need to be having face-to-face clinical teaching as well.
Yes.
And I remember how the PPM has to shut their doors to the medical student because you have created a cluster.
Yeah.
So you can see that how because of that, people start to, among the students, you know, that are blame game, you know, like this department blame the other department because I'm the coordinator for stage 3.2. I can see that in the group of the coordinators, we are also very, very distressed. So we do feel that the issue with regards to the pandemic affecting the medical students is real and is significant. It's just that we do not know how far this is going to affect, especially those graduated soon or have graduated. I remember Prof. Adiba did mention that it is quite worrying if we were to figure out from 5 years from now, the doctors that graduated during this pandemic, you know, how much of the knowledge that we can expect them to be able to prepare themselves, you know, as a future doctors. But whatever it is, I think we need to be very positive. Yeah, we are talking about mental health care. If we were to talk about anxiety, depression, I'm very tired talking about this, because, you know, among like I'm involved with the psychological first aid in the PPM, and there are a lot of issues about stigma, a lot of issues about the nurses going back to work and all that. So the best thing to do right now is what can we do? You know, we need to start to look at the positive aspect of going through a tribulations like this. So definitely whatever damage has been done, it's like a tsunami. When a tsunami comes, it involves it, you know, geographically, psychologically, and everything sometimes be wiped out. But sooner or later, people start to become stronger. So I do believe that definitely one of the ways to overcome this is to start to work on what kind of strength that we have in what we call as to be resilience. Yeah. So I think we need to be more talking more about creating a generation that is more resilient, instead of those with fatigue, COVID fatigue or Zoom fatigue generation. Yeah.
Yeah.
Yeah. So I think it's about time we start talking about that.
So, like you said, doctor, whenever someone is facing like mental health issues, if they're struggling, we have to do something about that, right? So, how should the students seek help? Has it changed? Is there any difference before and during this pandemic?
Um, I would say that I do see more of the adolescents, I would call them youngsters lah, the young adults coming to seek help. Because they know they can come at any time to, if we have our walk-in clinic
Mm-mm.
in psychiatry, but I'm not too sure with regards to the students clinic and all that. So but we do see a surge in the number of cases among the youngsters coming to our clinic. And like I mentioned earlier, we have got a few cases when, for example, one of the students during the MCO, she has to stay at home, and then she became hysterical, and the parents was wondering what's going on, and eventually she start to have this self-injurious behavior. So it turns out to be she has been sexually harassed or harassed by her own family members,
Mhm.
and by being away from the family, she avoid going back home during semester break. She does a lot of this charity work just to be away from the family. But
Mm.
because of the MCO, she is living with the perpetrators, who is
Mm-mm.
also one of her family members. So then you can see that actually this kind of thing create um, how should I put it, the family members becoming more aware about what's going on, by having through the observation that the daughter or their son experiencing distress, and a lot of times these young adults, when they are undergoing severe stress or anxiety because they have to stay in a house where the person who's been uh, you know doing the kind of indecent behavior, then they started to exhibit this symptoms of severe anxiety. They started to shout at night and then screaming, having night terrors. So then only the family realized that, oh my God, she has gone through this and we didn't know all this while. So in a way, we do see an increase in the number of this group of adolescents or young adults coming for help, because I think the information, in the news, they start to see that it's okay to come and look for help. So this illness seeking behavior seems to be becoming more and more positive. Yeah, and with the hope that with the increase in the literacy of the mental health, then people will start coming and talking about their issues. Yeah.
Mhm. So, in regards to seeking help, what's the difference between a counselor, a clinical psychologist, and also a psychiatrist? And also, during what circumstances should a student seek and refer to the each individual?
Okay. In terms of the hierarchy, as you all know, psychiatrists are doctors. We are a
Mm-hmm.
physician, and we manage cases just like any other disciplines. Like the family medicine specialists and all that. A psychologist and counselors, I may not be able to give the exact definition for both, but the way I work with the counselors and the psychologists in my department, I do see that the counselors, they spend more time talking, what we call as talking therapy, They have a set of rules, cases in the management of the patients through therapy.
Mm-hmm.
A psychologist, usually they use a lot of these instruments, modules and models, yeah, and of course in terms of their management, as a psychologist, some of them do have this clinical psychologists. They can work as good as some of the psychiatrists. It's just that they do not have the capacity to treat just like the doctors, because they are not a
Mm-hmm.
medical doctor. So like now in my program, student wellness program that I have initiated with Abdullah,
Mm-hmm.
Gan, Chiang, um, but and we managed to get the counselors to come and work with us. Um, uh, uh, but unfortunately, for now, I can say that we can't proceed just yet. But I do get in touch with the Hal Ehwal Pelajar counselors and psychologists. So basically, most of the time, for those who are experiencing, a certain level of distress, the, usually the first line are the counselors,
Mm-hmm.
and then the counselor will do series of this session, um, and and sometimes they do combine the therapy and work together with the psychologist. And only when they discovered that the severity of the illness, especially those exhibiting thoughts of suicide, or becoming more uh, in terms of the psychosis, so they will not manage, so they have to refer to psychiatrist.
Mm-hmm.
So because most of the in general, people would rather go and seek help from a counselor rather than a
Mm-hmm.
psychiatrist. Again, the labeling and the stigma is quite strong, but
Yeah.
as long as they seek help, it's good enough. It's just that most of the time, the counselor, when they realize that the level of the degree of depression has becoming quite severe and they need medication, then they will refer to psychiatrist. Yeah.
Mm-hmm. Okay, so thank you, doctor, for that. All right, so there's this thing called PFA, if I'm not mistaken. So I
Yep.
think it's best if we introduce PFA to the audience. So, doctor, what is PFA? Who are they, and what's the role of PFA?
Okay, PFA is a psychological first aid. Is actually everyone knows about first aid. Yeah, when someone have a cut or injuries,
Mm-hmm.
you apply first aid. Okay,
Mm-hmm.
like CPR is first aid, and which means when if we were to apply that to a psychological first aid, it's almost similar, but you don't see the blood, you don't see injuries. But what differentiate between the psychological and the physical first aid is that initially, when this PFA was first documented, it was
Mm-hmm.
actually been applied to those who undergone a traumatic experience, especially those who came back from the a war. They have got PTSD and all that. And then
Mm-hmm.
subsequently, it has been used, especially those in the disaster-prone area,
Mm-hmm.
like tsunami and all that. Even in Malaysia in 2014, we have this banjir besar in Kelantan.
Mm-hmm.
So, so therefore, it is actually a one-off. You don't have a PFA that you provide for like 2-3 months of PFA. It is actually an acute intervention, whereby anyone been trained to provide PFA. We call them as the first responders or aiders. And by providing psychological first aid, you can help so many people before they actually becoming serious. Okay, for example, like COVID-19. So we have those who have been diagnosed with COVID-19 admitted to the ward, and in like my department, we cater for the healthcare workers, the frontliners in the hospital. So we have got cases where in the family, the mother, the patient is a staff. The mother had COVID, the patient got COVID, and the husband. So all three of them got COVID and got admitted. Unfortunately, the mom didn't make it, so the mother passed away. So and she felt guilty because she felt that she's the one who transmitted the illness to the family, and while she's in the hospital, away from her own children, her mom passed away. So this is a very traumatic experience because number one, she already have the guilt feeling because of me working in the hospital, and then number two, she has she felt guilty because she can't be there for the funeral, and then when she once she's already confirmed negative, she when she went back home, the neighbors start looking at her as if don't go near her because she may be still having the virus inside her, you see. So so this group of people, when we start providing psychological first aid, number one, we have to do it via online. We can't do it face to face. So PFA during COVID is not the usual traditional PFA. So so we do training. We provide training for the PFA where we the most important basic of PFA is for you to be able to prepare yourself. When you see someone who seems to be very distressed, you offer help by asking, do you need help? I noticed that you look quite distressed, you know. So then that person may open up. They say, yes, I feel very bad about this. So then you start to listen to her story. But as a PFA, you don't do therapy. Your job is to observe, pick up the cues from that person by your observation, and then you start asking questions and listen. Then with your knowledge, you offer help. Do you need help? I know where to get help. If you need help, I can take you there. So it's about that. So that is why I'm trying to also add this PFA concept in the student wellness program, because I want everyone to feel that the need to help others, and you don't have to be a doctor. Even at the lowest, I mean, in the hierarchy of the organization, if that person work as a janitor, you know, a cleaner, but they want to help, yes, come in, by all means. We're going to teach you on how to be first aiders. So I would say that if you go in Google or look in the Google Scholars PubMed, they already started to apply PFA not just for traumatic experience. They use PFA as part of the intervention in weight loss program. You know, those who are going through eating disorder, they actually have been going through abusive environment, and they are suffering quietly. So then they start to apply PFA concept to these people. So it's no more about disaster, one-off thing. So COVID has changed the perception towards PFA, and this is good because again it improves the literacy. Number two, it improves in terms of help-seeking behavior, and people can always just get someone that they trust to talk about their problem, and that person can offer help. I think I know someone whom I can take you to, and she's a counselor, she's a psychologist, she's a psychiatrist, or she's my best friend, you know. So it's just a start. So I would suggest that Minda or MEDSOC start propagating this PFA. And of course, due to COVID, a lot of things can't be done in a big group. But yeah, I think it is a good way on how to start reaching out, especially those who have problems communicating or talking to people. Yeah.
Okay, I'm very sure Minda would take that into account to, produce more PFA among us. There's a
True.
lot.
Yes.
Thank you so much. I feel like there's a lot of input you gave throughout the first segment. Even to myself, there's very new knowledge. Adding up more information. Okay, so we would have to move on to our Q&A session. So to our
Yep.
viewers, if you have any questions or doubts that you would like Dr. Zuraida to answer, go ahead and drop your questions at the comment section on this Facebook Live. And if you want your questions to be read anonymously, you can always post your questions on Mentimeter. So just click on the Mentimeter link provided below. And also, we would like to apologize since we have limited amount of time. We will only be answering the spicy questions that are posted for today, okay? Alright, so we have our first question here. Doctor, can you give an opinion or assurance regarding mental health among medical students? Because I think medical students are also afraid to get diagnosed as it may affect their future as a doctor themselves.
Okay. You want me to answer that question?
Yes, yes,
Okay.
doctor.
Right. I know there are a lot of students have this dilemma. Yeah. All I can say is that even you are already a doctor, uh, we do see a steady number of housemen coming to seek help or being referred to us, but none of them has been stripped of their title. Okay, so what more if you are a medical student? So you, the problem with being a medical student is that from the very beginning, before entering medical school, people look up to all of you. Even I was, a medical student once upon a time, many, many years ago. So we are so afraid of being ill. In fact, if I were to go back kampung and I start having, flu and all that, then they say, doktor pun sakit juga ke? Like we have been, people look at us, the society, again, the society perceive us as the perfect or the cream of the cream. So we are not supposed to be unwell, physically or mentally. It's just that that this fear among the medical students, that what happened if my friend see me seeing a psychiatrist sitting in front of the clinic. What happened if my own, so that kind of things, definitely it caused even more difficulties for the students to come forward. But again, like I said, of course, if we were, because this is very common, okay, I think 10 years from now, every medical student will still be asking this question. That's why in the United States, every medical school, they have this student wellness program. Okay, and I really want to see that what we have initiated from Gan, Chiang, and Abdullah, this wellness program is actually will be the first step for any of your friends who need help. Do not have to go to see psychiatrist just yet, because by the time they already been in a group of the group that they trust, like in having PFA first responders, they have a smaller group, and they start feeling trust, giving trust to this group to discuss about their problems. Then you can mitigate that problem from the very start, before it becomes difficult to handle, and until they start screaming and having severe anxiety. So I think this issue about medical students being afraid of being diagnosed or being seen in a clinic, seeing psychiatrist or counselor or psychologist, actually this is not going to end, just like stigma. But like I said, having a first platform of PFA led, a medical student led PFA, with the guidance coming from our department, I would say that this is going to be a good start. Yeah, because I know I can never give the exact answer to this, how to overcome this issue of fear of being seen or being diagnosed. But for your information, we have doctors been diagnosed with schizophrenia and they are still practicing, you know. So as long as they know they need medication and need to be on treatment, so we are human beings, yeah. So we tend to have a lot of difficulties from on a daily basis. Yeah, so I hope I answered that question. It's just that I don't have the answer, but I think it's about time we take this PFA seriously and start to go into our student wellness program, you know, in a more structured manner.
All right. Thank you, Doctor, for answering that question. Okay, we can move on to the next question. Okay. Right. The next question will be, Assalamualaikum, Doctor. With social media,
Salam.
people are more open to discuss their struggles and victories with mental health publicly. So, what do you think are the consequences of this, Doctor?
Okay, again, like I mentioned earlier, somehow what I learned from the youngsters who come and seek help in my clinic is they realize that there are different sets of or different group of people who wants to feel belong to. I've got one of my favorite. I won't call her patient. She's my friend now. So she was struggling with depression, and then she was trying to look for help within the social media, and then she got scared, and then she asked me, Doctor, I do see a lot of people are suffering out there, but the way they put it in the social media is like it's worrying because they said to telling people hashtag depression is cool, suicidal is okay. What the thing about voicing out their victories or struggles online anonymously is one way of them trying to communicate. So I do see that it's actually one way of communicating. It's just that the manner that it was done becomes a two-way, but it's like I'm the one telling my stories about my struggles, and then I get hundreds or thousands of response, and it can be in the form of negative comments, and we remember this girl who going online and asking whether should she commit suicide or not. If yes, say yes, and she start counting the numbers, and she finally, it's scary. So
Yes.
and unfortunately we live in a society where people like to see people suffer more than people having victories. Like I won a game and I start showing it off in my Insta whatsoever, and then you get negative comment also. And it looks like people want to see more people to suffer, and to suffer together. So it's quite worrying. But again, like I said, for Minda or MEDSOC to have a platform where we can discuss, it will be good. But again, issue about confidentiality has always been a problem. People have come forward and in fact approached our department if we can actually provide this platform where anyone can just ask questions, and then we provide the answers. But unfortunately, because we are bound by this medical, legal, and ethics as a medical doctor, we are not allowed. If you can see, like befrienders, and we have in the newspaper like the Star, Dear Telma, so they are not medical doctors. So they do not have this issue about medical ethics like what we have. So again, like I said, we can create a platform, but a lot of discussion needs to be done, especially with regards to the confidentiality. Yeah, we can try to use this platform where most of the youngsters would love, you know. So again, we can create and work through this, yeah, so that they can have a platform, the right platform, and get the right answer or response to their problems. Yeah.
Yes, thank you, Doctor, for answering this question. Okay, so let's move on to the next question. Right. So, good evening, Doctor. How should I explain to others regarding the rising trend of psychiatry illnesses? As some of them tend to comment about this as it is too easy to be diagnosed with mental illnesses. Sad to hear those comments, but they do present.
Mm. Well, if I understand this correctly, the number of patient been or anyone been diagnosed with mental illness, we can see a sharp increase, um, and then and people start to wonder whether is this some kind of is too good. I mean, can anyone? And it seems like anyone can be diagnosed. It's
Mm,
as easy as that.
mm,
Again, like I said, if we were to look at the data conducted by the Ministry of Health, we can use that as the right, the evidence that we have so far. But if we were to go and read some articles where they try to portray suicide and mental illness as something that, you know, yeah, it is severe, but we have, among psychiatrists, we discuss about this media, the 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 manner that they report cases on psychiatric illness. Sometimes they try to make it like out of proportion. Although yes, we do see the increasing or rising trend of these mental issues, but a lot of people may look at it like being very cynical, like, what do you mean? Are you saying that the mental illness is far more important than other sickness, like, cardiovascular and all that? So the issue is, what people need to understand is not really much of the numbers, because the number is going to increase anyway. Again, like I said, the only way for us to overcome this is by giving the right information that, number one, yes, psychiatric illness is increasing by the day or by the year, but there is always help. Yeah, so we
yes.
want to people to know, yes, it has been increasing, but we are here to help. So whatever comments that people make, some people, they make fun of it, like, oh, you mean I can just Google and just diagnose myself as having depression, is it, oh, I found this online, uh, and then people making fun of it. And in fact, they come to the clinic, like the sister would say, I want you to check my son, my brother. Yesterday he just did this test online, and he seemed to be suicidal, and she was laughing away, so so I said there are a lot of people, regardless their background, their knowledge and all. What we are more interested is those who are genuinely need treatment. And for us, I'm so happy even now, the medical students are very active into this, because I do get requests from other faculties, because the students from other faculties also need help in terms of their mental health issues. So I wish I can say that yes, we have a very strong team in our faculty. Definitely we can always have this group of, medical students to come and help your fellow colleagues in other faculties. So I think we are on track. Yeah, whatever comments that people make about mental illness is the way of them expressing themselves. Look at that way. It is a way of them trying to communicate, but in in a rather inappropriate manner, I would say.
Mm-hmm.
Yeah.
All right. Thank you, Doctor. So we have one more last question. Okay, so our last question for tonight's session is how to differentiate between real depression and just overthinking that we're depressed, because I'm afraid that if I seek professional help, it is just something that's not so serious.
Okay, depression is about your mood, and sometimes it's about your energy. Okay. Some people say that I don't have the mood. What do you mean? I don't have the feeling. I feel numb, you know. I have quite a number of them. And then when they feel numb, they always believe that in order to be depressed, you have to feel low. The thing is, if you're physically already having chronic fatigue, you know, I'm so tired, I have to drag myself off from the bed. And I have these thoughts. You know, when to understand depression is to understand these three concepts. Is what is your emotion like, or your mood? What is the thought or the ongoing thought? Are you ruminating on something of negativity, which create this action or inaction? So when you have got this combination of the thought that you do not like in your head, and then it gives this kind of unpleasant feeling all the time, and because of that, I don't feel like going to class. I don't feel like going online, and this is just not me. So you need to seek help, regardless whether it's severe, serious or not. So again, like I said, yes, do you a lot of these questions, whether am I depressed or not? I think I'm depressed, but I don't feel it. It's, you do not have to be having low mood. You can be someone without energy. I don't feel like doing anything, but you're actually depressed. So so that is why it is so important for you to talk to someone that you trust, especially when we have this PFA group. Yeah. Then this person already been trained to know the symptoms of depression. And then you said, yeah, I think it sounds like you do have, well, although this is not like the major depressive disorder, but this is some kind of, probably it's a burnout issue. You know, it's a chronic fatigue issue. I think why don't we go and get clarification about this? Yeah. So whether it's serious or not, I think the first step the counselor would be able to identify, you know, and then, you know, if, yeah, I think you have got depression, it's best that you seek help from psychiatrist, because the doctor can only give you medication. Yeah. So in our hospital, we don't, not necessarily psychiatrists, even the family medicine specialist can already prescribe antidepressant. So so meaning the help for your mental health care can be also be provided by the, you know, the family medicine specialist, you know, the doctors in the clinic, student clinic and all that. Yeah. So again, like I said, we need to work on this student wellness program. We need to work on this PFA. We need to get more students to come on board and be the aiders, and we form smaller groups and show to the world that, yeah, we have got this. Because like I told Gan and the rest, in the US, all medical schools must have this student wellness program. And we can start to have one, and probably we can share with the other universities, you know, once you get it on board. Right.
Yes. All right. Thank you so much, Doctor. Okay,
Welcome.
so we've come to an end to our session tonight. Thank you, Dr. Zuraida, for this valuable and very meaningful sharing session on T session hashtag Mind Your Mental Health. So it feels very close to heart because we are all struggling mentally, especially during this pandemic when everything has been online, studying online, even extracurricular activities and projects are online too. So we hope that this has at least given a food for thought that seeking help regarding mental health should be normalized, because most mental health issues are treatable. So it's better to be safe than sorry.
True.
Yeah.
Agree.
Yes. Thank you, Doctor, for this session. So
Okay.
everyone, to all viewers, don't forget to follow our Instagram, which is at minda.ummedsoc. And if you have any comments for this session or you would like to see more similar sessions being organized, do fill out the short feedback form provided on the screen later on. And this tea session, hashtag Mind Your Mental Health with Dr. Zuraida, brought to you by Minda by MEDSOC. Thank you everyone and good night.